1 second, Jared. There might be a delay.
There might be a delay, yeah.
I'm on the YouTube channel, so we're just trying to see.
Okay. Hi, everyone. Good afternoon. My name is Jared Raftery, and I am the Marketing and Communications Manager at the Graduate School of Biomedical Sciences at the Icahn School of Medicine at Mount Sinai. Thank you so much for joining us for our student panel for our Master of Science in Biomedical Data Science and AI. So here I'm going to introduce you to our 2 student panelists. So take it away. Please tell us your name and a fun fact about yourselves.
Yeah, my name is Amit. I'm finishing my first year in the program. And fun fact about myself, I'm going to think about it while you introduce yourself.
All right. My name is Ajani. I've already graduated from the program last year. Fun fact about me is that, we were just talking about this. I used to live in La Jolla, California, or San Diego. And apparently the ocean is fairly cold there.
Well, then as a continuation to that, just a couple minutes ago, we were speaking about our experiences. And so I just came back from a ski trip. So I'm a huge skier. So that's a fun fact about myself.
Awesome. Thank you, guys. So my first question for both of you is, why did you decide to study data science at Mount Sinai? And Ajani, I'm going to start with you. Tell me about that.
Yeah, so my introduction to academia was when I actually lived in La Jolla, California. I worked at Scripps Research, and there I was introduced to the world of biomedical research intertwined with data science. And I thought, even though it was fairly challenging because you're dealing with really large complex data sets, I thought maybe I can take my career to the next level and actually study it in a way that's a little bit different, because this is a newer program, a newer expertise in a sense, and so I just wanted to explore that to see what kinds of problems there are in the healthcare space to understand human health and disease.
Excellent. And Amit, could you tell me similarly, what inspired you to come here and study data science?
Yeah, so I guess my story goes back. I've always dreamt about being a doctor. I always wanted to do that, be a physician. And so I also did my bachelor's degree is in pre-med, but kind of like life led me into the CS, so computer science world. This is also what I do for a living. And so before applying to medical school, I wanted to do a program that will kind of encapsulate both these fields, both the biomedical field that I had experience in from my previous studies, and also that relate to my future, my future as a physician, but also to have some touch and some association to the computer science, the technological part of this program. And so I think this program, for me personally, is a good fit to exactly what I'm looking for.
And so you'd say computer science is the type of undergraduate major that would be really helpful for someone in this program?
Not necessarily. I mean, I'm not even a computer science undergraduate. You will be ultimately exposed to a lot of the materials, a lot of the concepts that computer science majors are exposed to in their undergraduate, but you can very easily catch up on those things. And I think one of the benefits of the program is that you have a lot of people coming from various fields, and this enriches the program and the people in it.
Excellent. That's great to know. So I also wanted to ask both of you, what has been the most impactful part of the program for you so far? So Ajani, why don't you tell us about that?
Yeah, so one of the most impactful experiences is actually joining a lab that kind of piques your interest. And so one of the labs that I joined is closely associated with the Brain Body Institute here at Mount Sinai. And mainly what they focus on is understanding the interactions between the brain and the body. And the hope is, that can uncover some new therapeutics and diagnostics. And so, that piqued my interest because there's a lot to explore there. They're still fairly new to the concept of data science and AI. Most of the folks in the group is heavy on wet lab instead of dry lab, but they're starting to warm up to it, slowly but surely. But yeah, so being able to understand these convergence of technologies and opening the door to newer tools can bring light to some of the problems that are associated with brain and the body, and so right now one of the interesting projects I'm working on is trying to understand the molecular underpinnings of anhedonia. And for those who don't know, anhedonia is where patients have the inability to experience pleasure. So things that were pleasurable before aren't pleasurable now. And so it's a really debilitating mental disorder. And so what we have done at the Brain Body Center is we've had collaborations with Mount Sinai Hospital to collect samples from patients and seeing if we can actually use machine learning and AI to kind of bridge the gap between what we find in the lab and what's being evaluated in the clinic. And so that's partially what we're involved in at this point.
Yeah, that must feel so cool to see the efforts of what you're doing actually be applied in a clinical setting.
Absolutely.
That must be really inspiring.
Yeah.
And Amit, can you tell me as well, like, what's been the most impactful part of this program for you so far?
Yeah, so it's going to be very similar to what Ajani just mentioned. I think the capstone project, or the project that Ajani was referring to, is essentially you start working on it in the middle of your program, right? And that's basically the holy grail of the program. You get to apply the concepts that you've been learning in class with real scenarios, with real research. And so I think for me personally, this is kind of the most interesting part of the program, but also for other people. If you're a young scientist who's willing to, discover new things or is willing to be at the front of research, and this is probably being said in every program kind of interview settings like what we're having, but if you're really interested in those fields and you're willing to discover new things, I think this program is giving you the right setting for those things. So for me personally, of course, just like Ajani just mentioned, the research program or the research projects is the most interesting part. Everybody in their own research, I can tell about my research, but Ajani did a good job at kind of explaining the concept, I think.
Oh, that's awesome. So obviously AI has come up. It's a big topic. We've added AI to the name of this program. We're trying to integrate it as a larger component. How do you see AI intersecting with data science in the future and becoming more prominent there? And Amit, I'll start with you since I've started with Ajani a few times. You can mix it up a little bit.
Yeah. So AI is being pushed into a lot of places by now, and I think that we've reached a point in medicine, but also in other fields, but in medicine specifically, that it is really the amount of data is getting beyond what we're able to do or what the human person is able to actually go and analyze. So we obviously need to rely on AI and smarter tools to help us in this process. And I think Ajani is, of course, has finished the program, but and I'm not sure if this was in previous years, but in my program, there's a lot of AI content, a lot of AI specializing researchers and professors who come in and share their work and their experience. So you do get to be exposed to AI concepts, AI methodologies, and this is all very, very new. So I think in that context, there is also a lot to be developed, a lot to be discovered.
Yeah, and I'm sure that's exciting to you, right? Like being part of something where you can help pave that way and help with those discoveries.
Yeah, absolutely. So one of the most, and we always laugh about this, but one of the most common answers to our that professors ask or answer to our questions is like, we don't know. This has not been researched. So again, if you're a young scientist who's willing to discover new things, and you're interested in both these areas, I think this is a good program to do this in.
Yeah. Ajani, does that ring true for your experience now that you've completed the program and out there working and seeing this day to day?
Yeah. So like, just like Amit mentioned, there is a lot to be unfolded in terms of understanding data science, where to apply data science and where to apply AI. I think sometimes, we're also like encouraged by like the hype involved in AI, and we want to just throw AI at everything. I think in biomedical research and also in medicine, it's not that straightforward. So a lot of the things that they kind of emphasize in the program is to look at your data set. And maybe you'll find ways to generate hypotheses from your data set, and that's to me where you start to actually move the needle on things. You start to progress your actual project, or your or it could be like a little hackathon. If you're able to generate hypotheses in a data-driven way, with or without machine learning, I think you're in a good spot. And so, that's partly some of the things that the program kind of introduces you to, and it's really exciting. It's and I think if you want to be a part of this, you just have to realize that you're going to have to be bilingual. So you're going to have to understand like the data science component, and probably the AI component as well, and also your domain of interest, right? And so being able to actually move between languages is really important, especially if you want to make this actual career. And so I think that will actually be, I think it's actually helpful advice. And they try to distill that within the program as well. So that's really cool.
That's excellent. Thanks, guys. Those are really interesting answers. I also wanted to ask about what activities and experiences that you've had outside of the classroom that have contributed to your success. So Amit, why don't you start and tell me about that?
So I'll start off and say that, of course, the biggest out of the classroom activity is the lab work. And you'll get to spend a lot of time in there in the lab doing whatever it is that you're doing. And I think with my lab, and it's different with every PI and with every lab, but with my particular lab, I also get to go with my physician, which is the PI, to see patients and collect the data. So you do get to, depending on what lab you're in and what the scope of the work that you're doing, you do get a lot of extracurricular activities. But generally also, this affiliation to the hospital opens a lot of doors to additional extracurricular activities based on your interests. So I know people in my program are volunteering in different departments within the hospital, or really whatever it is that you can think of. Probably there is someone in the program or in anywhere in Sinai who's doing this. So there are a lot of opportunities to do that.
Yeah, that's great. Thanks. And Ajay, why don't you tell me about yours?
Yeah. So yeah, there, like Amit was mentioning, there are tons of opportunities in the landscape of medicine and also biomedical research. But one of the, I guess, extracurricular activities that I participated in was this student-led effort to combat antibiotic resistance, which is a kind of a tall glass. And so one of the things that we did, and this was a collaboration with some med students. One of the things that we did was we interviewed emergency medicine residents to understand, how they view antibiotic resistance. This is, keep in mind, this is in kind of post-COVID. So what's actually happening is on the ground is when a patient comes in and they have some respiratory tract infection, it's really hard to tell whether that infection is bacterial or viral. So there's an actual biomarker tool that can be used to distinguish between whether a patient has a bacterial infection or a viral infection. And the problem is that some residents don't fully actually utilize this tool. And so these are the things that we're actually collecting and trying to understand in different surveys when we're interviewing these EM residents. And so what we did was, by us collecting our interview data with them, we realized in order for us to basically make this problem a more or drive awareness of this problem, we needed to find another data set other than interview data. And so what we did was we collect a bunch of patient visits from the electronic medical record system, or EPIC. And we found some really interesting things. This goes back to the topic that I brought up prior was generating hypotheses. And so that's essentially what we did. And we found some interesting things in relation to antibiotic management and how that was actually implemented on the ground in emergency medicine. And so we presented this to leadership here at Mount Sinai Hospital of some of our findings. And and behold, there was a huge kind of push for us to implement an intervention in EPIC, so electronic intervention, to remind residents to actually administer these tests to distinguish between bacterial and viral infections, in order for us to have the best quality of care. And so so that was my experience. I didn't mention that before we actually presented this work to leadership, we got a chance to actually shadow EM residents, actually see how they carry out point of care and things of that nature. And so it was a very immersive experience. And so that's some of the things that you can actually participate in within this program. You get that immersion, in terms of human health and disease. And so that was my experience.
Yeah, that's incredible.
I think that's a very good point.
Yeah.
What Ajani just mentioned, that is a representation to what you can get out of it, because Ajani, correct me if I'm wrong, but this was relatively fast from when you developed this to kind of actually this tool or this biomarker tool being used.
This was so our project. It was very fast paced. So we completed this and we found some interesting insights through this data set. It was like a 2-month process, so it was really, really fast. So we had to really, really be on this and actually dedicate ourselves to finding a needle in a haystack,
right.
Essentially.
Yeah. So what I was trying to say is that this field or the program is so kind of thirsty and craving new people with new ideas, and you can really get a result, or you can actually see the things that you've been working on in the field being used in a very fast turnaround, right? So
absolutely.
I think that's one of the most interesting and fascinating things for me specifically, because if you write a paper or something, it could take years and years until you see your paper being published. But whereas if you develop a tool that can be used by physicians, could be used by residents, could be used by people who are actually seeing patients day in and day out, that's the difference.
and
Yeah.
you're actually able to make an impact, right?
Yeah.
You were able to pitch to leadership. You had them listen to you because you brought rationale, and then you're actually able to implement it. I think that's
Yeah.
really impressive. And as a student, that's something I would want as well. So that's awesome. So my last question for you guys before we turn it over to some audience questions is, what are your career aspirations upon completing the program? So Ajani, you've already completed. So why don't we start with Amit, because you're still in your first year in the program. What would you, and you spoke a little bit about some of your
Right.
aspirations, so I know that, but
Yeah.
tell me about what you want to do after the program.
Yeah, so I'm planning to take this degree to medical school, and specifically the MD PhD program. I think that as a physician researcher, I will be very much interested in researching within this field. Obviously, because I have some experience in this, and with this program a little bit more. But B, because, and that's mainly the main reason, because I think there's so much that could be discovered, and there's so much that can be done using technology that is, and I feel like as opposed to maybe other fields, the medical field is kind of neglected on this part.
Mhm.
So this is kind of my aspiration, but probably Ajani will talk about this. And other people in my program have completely different aspirations. You can do so many things with this degree, whether this is to just go and work in the industry where data scientists are always required. This is a commodity. So you can basically do anything, whether this is industry, to stay in the academia and into research. Everything's open for you.
That's awesome.
Yeah.
The sky's the limit, right?
Yeah.
Okay. And Ajani, again, you've already completed the program and are working here, but tell us about what your aspirations are moving forward.
So my aspirations is to, go back into grad school, get a PhD, hopefully. Right now, we're in the midst of drafting up a manuscript. Hopefully it can get published at some point, and that could be, a ship to graduate school. But at this moment in time, I'm also interested in also working with hopefully some startups that are coming to the fore in specifically biomedical research, and they're also combining AI tools and things of that nature. So the convergence of technology thing that I talked about. There are a lot of different new and up and coming startups that are trying to make a case for, whether it's a diagnostic or some discovery tool that allows them to I guess get the next blockbuster drug or whatever the case might be. But so that's exciting. So I'm interested in exploring all different types of opportunities, because you can do a lot with biomedical data science and AI. So at this point,
that's excellent. So we're out of questions, but I just thought of one more thing, I think, to wrap this up. What advice would you give for students interested in applying to this program? Any advice or any tips, anything that could help them as they're crafting their application or thinking about what direction they want to take?
I would say in terms of advice, really read into the program and try and figure out if that's something that is of interest to you. Understand that there is going to be some computer science specific things involved. There's going to be some medical science specific things involved, and again, figuring out whether you're comfortable with that bilingual aspect, and that's really important. And so right now, data science is kind of like a hot field right now. I think Berkeley has shown that it's their largest major at the right now, so it's bigger than CS at this point. So that's encouraging. So it's pretty hot right now, but biomedical data science is still coming to the fore. So make sure that you're really comfortable with those things.
Yeah, and I would also say be prepared. This is graduate school, so and this is not the type of program that you can just sit back and take notes and just passively gain that knowledge and you'll be good to go. You'll need to be creative. You'll need to think out of the box. You'll need to actually do things and be hands-on. This is a very hands-on program, both on the computer science and coding part and also on the biomedical thing or aspect. Like Ajani said, you need to speak both languages fluently. So also be prepared to work and think out of the box and be creative and not just sit tight and wait for this to end.
Exactly.
Yeah.
It sounds like there's a lot of resources we have available throughout Mount Sinai, and it sounds like both of you have done an exceptional job of taking advantage of those opportunities to pursue your own personal passions.
I will say, at least based on my personal experience at Sinai, if you ask for help, you will be given it. So there are so many resources and you may need to ask the right person, but people will always be very kind about telling you who you need to speak to. And at least in our program, it feels very, we have our program director, so it's very easy and there is very easy access to the resources and knowledge and everything that you need to know. If you have any issues or questions, it's always nice that you know that you have someone you can talk to.
That's awesome.
Yeah.
Well, I want to thank you both so much for participating today and shedding some light on your time in the program and giving some advice to our prospective applicants and students. So thank you, Amit and Ajani. Thank you.
Yeah.
Take care, everyone. Thanks for joining.
Well done.
We're done. Okay.